Inside the stories that affect you. This is Inside KELOLAND. Inside the stories that affect you. This is Inside KELOLAND.
Good evening, I'm Sammy Bieland. Thanks for joining us. On this week's Inside KELOLAND, we're getting an update on how South Dakota is responding to the opioid crisis. We'll talk with the outpatient addiction manager at Avera, as well as the Minnehaha County coroner about the impact this crisis is having on the state. We'll also talk with KELOLAND's Angela Kennecke about an upcoming vigil for the people who have died due to overdoses. Then we're talking with Tallgrass Recovery about its upcoming art show to raise awareness about addiction and how to get help. In recent years, Minnehaha County has seen a rise in overdose deaths from both legal and illegal drugs. In 2018, the county saw 23 overdose deaths. Now, that number has been steadily increasing since 2012. And so far this year, Minnehaha County has seen 15 overdose deaths. Now, those overdose deaths impact hundreds of families and friends and co-workers. One KELOLAND mother is opening up about her devastating loss to an overdose. Jenny Forrester lost her 21-year-old son, Alex, and he had been through treatment, and Forrester believed he was doing better. But then she found him on his bedroom floor one morning in March.
And he had a froth on his nose and mouth that I knew when I seen that froth that he'd overdosed.
Forrester wants people to know an overdose can happen to anyone in any family. KELOLAND's Angela Kennecke will bring you Alex's story and his mother's mission to keep his memory alive coming up this week on Eye on KELOLAND at 10 o'clock. Now, joining us now are Angela Kennecke, Malia Holbeck, the Avera Outpatient Addiction Manager, and Dr. Kenneth Snell, the Minnehaha County Coroner. Thank you all so much for joining us today. And as we just saw that poor mother describing her son's loss, she wants her mission to be that everyone struggles with it, no matter where they're at in life. Can you all just talk about how there's a stigma sometimes around drug addiction and how that's not true at all? Anyone can fall victim to this.
I really do see that with a lot of people too, and I think one thing that has been really interesting with the opioid epidemic and people falling addicted to these substances is it seems like the pathway to addiction has been a little bit different, meaning oftentimes they get prescribed these medications and soon after they find that they're developed a dependence or addiction to that substance.
I've had sheriff's deputies and nurses and people from all walks of life and all ages come up to me after I speak to communities about this problem and this epidemic and tell me that they were addicted, that they've struggled with opioid addiction, which always fascinates me because I think in our heads we have an idea that, you know, it's young people maybe experimenting with drugs or people who are homeless or those kinds of preconceived notions. And you found really, Dr. Snell, that people of all ages have succumbed to overdose death.
Yeah, I mean, if you look at what we've seen just this year, our #1 category are 40-year-old individuals. We're not talking about the 20-year-olds, as you mentioned. I mean, we're talking most of our cases have been in their 40s. But our range has been from 15 all the way to 67. So it's not pigeonholing everybody into this 20-something-year-old group. I mean, we're talking about it. And I think it's like you said, they don't all come into this the same way. When we look at the cases, they're coming from a lot of different backgrounds in a lot of different sections of town. And that sometimes I think is a surprise, is that, you know, as you mentioned, they're in the homeless area or things like that, where in reality, no. I mean, we see it come from all parts of the community. And I think that is, it does break that stigma because people are like, oh, if you have it, you're in this group. Well, in reality, no. And I think it does develop a lot of different ways.
And I know, Angela, you've made that part of your platform with Emily's Hope, is just to spread awareness and not be ashamed to talk about it.
Right. We're trying to stop the stigma, and that's one of the efforts by holding the overdose awareness candlelight vigil too, is to, just put it in the forefront of people's minds that this is happening in our community, and we've lost 38 lives since the beginning of 2018, and we'll have those people represented on the steps of City Hall on Friday night.
And we were talking before the show about the numbers, and Dr. Snell, you mentioned that even though they may seem like small numbers to us, in perspective with the state size, they're actually significant.
Yes, so if you look, say like here, last year we had 23 total, and the year before that was 21, so it's only 2. But you're talking about a community of 180,000. You multiply that to go to a larger city, Minneapolis, Chicago, that number really goes up. And so there it would look like a huge jump. For us, it's easy to overlook a 2 or 3. But then if you look at a particular drug, let's take fentanyl. Illicit fentanyl, this isn't prescription, this is illicit. We had been teetering like 1 or 2, maybe 3 a year. Last year we had 7. So that's a huge jump. Again, you take that to a larger city. Now instead of with 7, you're probably dealing with 50 or 60. That catches everybody's attention. So yes, for us, going from 1 to 7 would catch our attention, but it really catches people's attention when you magnify that. And again, the numbers that Angela and I are kind of talking about is our county, because we have good, hard data on that. Outside of this county, it's harder for me to have a good handle on that data because I don't always see all of those cases. I see a lot of them.
And I think just as a reporter, it's hard to get the statewide numbers quickly. The OD map isn't being used everywhere. But I do find that when I go talk to smaller communities, it's there. The woman that you saw the interview with there, she's from Chamberlain. I spoke in Presho, where 3 kids had overdosed and lived from opioids. And I spoke in Kimball to a young 16-year-old girl who was using meth and heroin both. So do you think that's true, Malia, that it is really everywhere?
It really is, and I think especially sometimes in those rural communities too, they really do get hit hard by this, and sometimes it is hard to get some of that data, especially if they did overdose, but maybe we were able to utilize some life-saving interventions to be able to help that individual.
That is the one thing I hear from the Minnehaha County Sheriff, that I think there were 53 overdoses, but more people are living now because of Narcan.
Yeah, there's a lot more of those individuals that get the Narcan on scene, and we recover them. And that's a huge effect, because without that, the problem runs into, then they don't recover, they don't get to go to treatment, and unfortunately that means they become one of my victims. And so the Narcan, I think, is a huge benefit. It's a benefit that our first responders, our law enforcement have it. And there are cases, as you point out, where I read, okay, well, there's someone, they got the Narcan, they recovered from it, and hopefully we don't see them again.
Right. We have to take a quick break. Don't go anywhere. We are going to continue our conversation on the opioid crisis here in KELOLAND and how you or a loved one can get help. Plus, we're previewing an upcoming vigil to remember those who have died from an overdose. We'll be right back. Welcome back to Inside KELOLAND. We're continuing our conversation with Dr. Snell, Angela, and Malia about the drug crisis in South Dakota. And we talked about how much the opioid crisis has spread here in KELOLAND, but things are being done to combat this, correct? Malia, you're on the front lines.
Yeah, you bet. So what we're doing kind of as far as treatment side of it is one pathway to be able to get help is to work with a licensed addictions counselor. So what we would be able to do from the treatment side would be able to do an assessment with that individual and then be able to come up to get a good understanding of the severity of the problem, and then be able to provide a recommendation for what is going to be the best level of care or treatment for that individual. So as far as clinical treatment, that can really range from inpatient treatment all the way to individual therapy, but we'd be able to work with that individual to figure out what's going to work best for that person. And there's some other pathways for help for that individual, is maybe working with their physician as well. The physicians have some options too with working with that person to see if maybe they'd be a good option for medication-assisted treatment.
And I know we talked a little bit, relapse can often be a struggle, and that, maybe one route of treatment is not going to help save them that time.
Yeah, I think if you can use kind of a multi-prong approach to a treatment, I think oftentimes we see some outcomes improving. But with opioids, I think what is so dangerous with this epidemic is that relapse. And that relapse is oftentimes what is leading to people's deaths. So the medication-assisted treatment really kind of provides that safety net for individuals. So if they do end up having a relapse, which sometimes is common in recovery, it really can be a life-saving intervention.
And then, Dr. Snell, talk a little bit about how when people are doing these drugs, they're not always aware of what they're actually doing.
Yes. The common thing that we see is we'll hear this person abuses heroin. But what we see when we run the toxicology is there might be a little bit of heroin there, but there's a lot of fentanyl, or there's a lot of cocaine, or there's another drug there. So the person's being told, hey, you're buying heroin, which is your drug of choice, but in reality it's been diluted down or cut with another drug that's more potent. So if a drug dealer normally would sell you a small bag, but when he's added something like fentanyl in there, that same amount now is going to kill you because it's got a more potent medication in there with it. And then sometimes we see where it's just, they'll say, this is heroin. In reality, there's no heroin at all. It is all fentanyl. And so, unfortunately, that is one of the problems we run into is they just think, oh, I've always bought this. I've always bought it from this individual. I know what I'm getting. And in reality, you don't know. And sometimes I hate to say it this way, is your dealer may not know because they're getting it from somebody else. So they may not realize that what they're selling is not that. I mean,
there are now machines out there that they can get. The stamp machine, pharmaceuticals grade, are actually real machines to stamp the pills, too, if it comes in pill form.
Yes.
Does it look like the real thing?
Yes. What they're doing is they're buying off-market a pharmaceutical-grade pill stamp. So it looks exactly like a prescription pill. The markings are crystal clear. They're perfect and everything. And what they're doing is they're taking a powder form of a drug. They're taking that powder form, putting it in the stamp, but the caveat is the stamp is, say, for a normal prescription pain medication you would get, but in reality it is 100% fentanyl. And so if you look at outside of the color being wrong, you'll think you're getting, let's say, oxycodone, when in reality there's no oxycodone at all. It is all fentanyl. Unfortunately, this is becoming more common. I recently was at a meeting where I heard about it, and then I think this month we've had, that I'm aware of, we've already had 2 of those show up. Now, it's probably been here a little bit before, because usually it's here before I see it.
Sure.
But I've already seen 2 of those.
Wow.
And so I think that's another problem.
And we're running low on time. I want to talk about the vigil. Angela, please describe what's happening.
It's free and open to the public. It'll be on the steps of Sioux Falls City Hall at 7:30 on Friday night. Mayor Paul Tenhaken will be speaking. A mother who lost her son to fentanyl poisoning will be speaking. We're going to have all of the overdose deaths represented and all of the overdose represented as well. And there's someone's going to, Elizabeth Hunstad's going to be singing Amazing Grace. And so it's just going to be a really nice event just to remember the people that this community has lost.
All right. Well, thank you all so much for taking the time to join us today. And you can find more information at KELOLAND.com. If you or a loved one needs help fighting an opioid addiction, you can call the South Dakota Opioid Resource Hotline at 1-800-920-4343. You can also find a statewide database for support services in your area on the Avoid Opioid website. Now just click on your county and you can find links to resources to help you. You can find all of this information on our website, KELOLAND.com, under the special Opioid Crisis webpage. There is another way to help those recovering from addiction. We'll tell you about a special art show that is helping families get their lives back after this break. Welcome back to Inside KELOLAND. Tall Grass Recovery helps people suffering from alcohol and drug addiction to discover a new way of life. And this Friday, you can help that mission by checking out some amazing pieces of art. Joining us now are Joan Zephyr, the admissions manager at Tall Grass, and Nate Riddle, one of this year's artists. Thank you guys for joining us. Yeah. Now, just describe what exactly is the mission of this art show.
This art show was created back in 2013 to help bring the community together, regular people who have suffered from the disease of addiction and their family, to tell the story of what that looks like and what has looked like in their life. The focus the last few years has kind of shifted away from more so the darker pieces of addiction to the joyful bright pieces of recovery, which is kind of beautiful, actually. But it was, you know, to kind of reduce the stigma, get the word out. You know, I mean, there's so much, everybody's so hush-hush about it.
Sure.
You know, I mean, it's gotten a lot better since, even since I got in recovery, but it's just, people want to talk about it. You know, there's shame around it. And if anything, I guess I would say if we could kind of break that barrier of shame, because everybody is affected by this. I mean, everybody is affected, not just the person who is addicted.
Sure. And how do you guys see art being a good conversation starter in this touchy subject for some people?
Well, when I'm an artist, and so when I first wanted to do the show, I said, okay, so how do you get people who don't feel like they're artists to actually create art? And the big thing was to sit down with them and have the conversation. You know, are you interested in being this? Yes. And then I would get these people to come together. And I would, you know, what is it that it looks like to you? You know, are you going to work in addiction? Are you going to work in recovery? Tell that story, whatever it is. And art is such a great way because you can look, it's up, and then they write an artist statement, and they look at that. People read that. And whatever that viewer takes away from it is maybe not even the intention of what the artist created. Sure. But it still makes an impact, you know?
And Nate, if you could describe your journey with Tallgrass.
My journey actually with Tallgrass started in October of last year. I went through their 30-day treatment, and with that I started to just learn a bunch of key factors that have allowed me to, at this point, have 9 months of sobriety. And so some of those things that I learned was like management of myself and just working a 12-step program and how to, I guess, get away from like the people and the places and the playgrounds that I had been in before. And it gave me a whole new like set of friends and people that, rather than just having friends while in addiction that were primarily just for drug use, now I have friends that go out of their way to make sure that I'm doing okay, or go out of their way to pick me up when I'm down, and just cool stuff like that.
That's amazing. And art, has that played a role in your life?
Art has played a huge role within this process of it. I think I've always had a love and passion for art, but this time around it's given me a relief from self. At some points when I get down or I get stuck in my like old patterns of thinking, it gives me that escape that I needed so badly. Just a way to release my like thoughts and something that I can do with my hands so that I'm staying busy. And it also gives me a sense of like the friendships that I talked about. It gives me the ability to reach out to those people and ask their advice, or simply just what colors to use, you know? And so that's been really, really like monumentous within my recovery, is just having that relief from self, because that was something that burdened me so much within my own addiction, was getting stuck in my old ways. And so finding a new outlet, or not even so much a new outlet, but just finding a different form to that outlet has been really, really helpful and made me so far really successful within it.
Amazing. And so your pieces will be in the show, is that correct?
Yeah, I actually
describe what we have here. Yeah.
I actually have this piece for you guys to see. This piece is the first one that I've painted for the Tallgrass event. It has a lot of color, as well as a lack there of color. It has the white and the black, which is a major contrast, and then it has the foils, which represents, to me, again, that friendship or the fellowship within the program that I work. And so each one, there was a lot of mistakes that I made through it, just like within my own recovery. It's not always been the perfect road, but it's been a road that I've gotten to make quite a successful journey on. And so each one of those, some of them cover up little blemishes that were errors in the beginning, and then some of them are just things that I needed to add to make like my art, my life better within the friendships that I've built.
That's amazing. And Joan, just remind people when the art show is, how they can take part.
You bet. The art show is going to be next Friday, the 30th. It will be at Post Pilgrim Gallery, which is on the lower level of the Last Stop CD shop, which is Jennifer White's gallery. It starts at 5, ends at 9. That'll be the opening night. There'll be food. There'll be lots and lots of people. All the art will be there, of course, and a lot of the artists. And then it will hang for the whole month of September, which is Recovery Month. So we want to kick off the month.
Perfect. Well, thank you guys so much. And we'll, of course, put all that information at KELOLAND.com. Stay with us. We will be right back. Welcome back to Inside KELOLAND. Earlier this month, South Dakota Attorney General Jason Ravnsborg joined several other states in a letter to Congress concerning the opioid epidemic. The letter urged federal lawmakers to remove barriers for health care providers when it comes to opioid addiction treatment. The letter says about 2 million Americans struggle with opioid use disorder. The attorneys general say while states are using every resource to combat the epidemic, more needs to be done by the federal government. Also earlier this month, KELOLAND News learned the CDC awarded South Dakota $2.6 million to put toward preventing opioid-related overdoses and deaths. Starting this fall, South Dakota will be one of 47 states receiving funds to improve data collection concerning opioids and overdoses. The CDC says this will help with prevention strategies such as strengthening prescription drug monitoring programs and improving support from health systems for those who need help. Now, there's a new warning about painkiller addiction and how it can start after a common surgery. About 5 million Americans choose to have their wisdom teeth removed every year. Meg Oliver has more on what patients and parents need to know to avoid the dangers of addiction.
Ellen Early's daughter, Sage, was a young mother doting on her 16-month-old son, Julian. In 2017, the 22-year-old needed to have her wisdom teeth removed.
The dentist prescribed the opioids.
Right.
Did he give any warning?
No. No warning, no nothing. In fact, he said, I think they gave her a 5-day supply, and he said, if you need more, just let me know.
Sage quickly became dependent, getting several refills before she found something else.
How quickly did it go from opioids to heroin?
Almost immediately.
Just 15 months after having her wisdom teeth removed, Sage overdosed and died in an airport bathroom on her way to a 4th round of rehab.
It was shocking, and she was gone, but mostly gone from Julian. That was the shocking part.
Dr. Chad Brummett studies pain at the University of Michigan. He says despite research that shows a combination of acetaminophen and ibuprofen is superior to treat pain, dentists are still prescribing too many opioids to young adults.
For many, dental care, such as wisdom teeth extraction, is the first opioid exposure. Could be like 50,000 kids each year becoming new chronic opioid users after just something simple like a wisdom tooth extraction.
Dr. Brummett's research found that simply filling an opioid prescription after wisdom tooth surgery more than doubled the odds of continued use among patients who had never used those painkillers before. In light of the epidemic, the American Dental Association has released updated guidelines recommending use of alternative pain relievers and a maximum 7-day supply when opioids are necessary. Ellen Early hopes more families learn about the alternatives to opioids after dental surgery. Almost a year after Sage's death, her grandson keeps asking when his mom is coming back.
He'll take me into her room and say, well, let's just wait. Let's just wait for Mama
to come home. That must break your heart.
Oh, absolutely.
Julian is now 3 and will start preschool this fall. Dr. Brummett, the University of Michigan researcher, told me it's still common practice for oral surgeons to write that backup prescription, but he says it's misguided and potentially detrimental. Meg Oliver, CBS News, New York.
And the American Dental Association says after updating its guidelines advising against prescribing opioids, dentists wrote almost 500,000 fewer prescriptions in 2017 compared to 5 years earlier. Now that's it for this week's Inside KELOLAND. You can find out more about today's topics online at KELOLAND.com. And be sure to join us every Sunday night following the 10 o'clock news right here on KELO TV. Have a good night.